Good day. Welcome to Westchester Talk Radio, westchestertalkradio.com, produced by Sharc Creative. I'm John Marino, and we are made possible by Entergy, the Indian Point Energy Center, supporting our communities through April of 2021. Lipolis Electric. Don't be left in the dark. Get Lipolis. And Hightower Westchester, managing your wealth to a fiduciary standard, along with our heroes at White Plains Hospital. We thank you for all you've done throughout the COVID-19 pandemic. Westchester Talk Radio, Sharc Creative, now also the home of Putnam and Dutchess Talk Radio as well, too. We are joined here on the Cup of Joe political show by Assemblyman Kevin Byrne. Kevin Byrne represents the 94th Assembly District, which today comprises a portion of northern Westchester, along with Putnam and Dutchess County. Assemblyman Byrne, we welcome you to the Cup of Joe political show, and we ask you, over the last year, the world has changed much. Walk us through how the COVID pandemic has affected your district since day one.
Well, first, John, thanks for having me. I don't actually represent Dutchess. It used to be in the district. It could be back in the district next year, but it's Putnam and Westchester. And like everybody across the state, across the country and the globe, the coronavirus has rocked our world. It's affected everybody at every layer of government. It's put people out of work, out of jobs, prevented them from visiting family. I mean, like so many of our fellow neighbors here in New York, I've lost family members and friends, and we weren't able to even send them off with a proper burial or wake. And it's obviously a very painful thing to talk about. New Yorkers do come together and face adversity. And I think we saw that in many ways last year throughout the course of the spring, supporting each other. And we've gotten through a lot of it, but we're obviously not done. We still have major issues that we're discussing. We still want to make sure that we get the truth and answers for what happened in our state's regulated nursing homes. But also we have to remember that we still have our elderly in nursing homes today. So it's not just about what happened and pointing fingers. It's about putting forward better policies to protect those people that are there now. We have our schools that we want people to be able to go back to school safely. And we got to make sure that we continue to do better to plan ahead and protect ourselves and our state and our nation moving forward should another pandemic come about. I'm the ranking member on the Assembly Health Committee, so this is something I've been very much involved in, researching and working with my colleagues. I don't think this should be treated as a partisan issue. It's really affected all of us. You look at the total number of mortality in New York State and the tragic loss of life. I don't look at those numbers and see an R or a D next to those people's names. Those are people, and they had families, and it's tragic. And we need to make sure that we're as prepared as possible going into the future. How has the vaccine rollout worked in your district in northern Westchester and in Putnam? Effective enough, or do we need to do better? In a word, we definitely need to do better. I would say statewide, it's been a bit of a mess, which may have been an understatement. And I think we didn't really utilize some of the plans that we had in the past. Granted, this is at a scale that we haven't had to deal with before. So I think that's important when we talk about this issue. But county governments have long had plans for vaccine rollouts and distributions. And this is unique because of the type of vaccine. And I understand the governor's office will talk about the ability to refrigerate the vaccine for storage was an issue. But in the beginning, he was relying on healthcare systems, not county governments. Then we had the federal government going through Walgreens and pharmacies. So we had all these different layers of trying to rely on vaccine distribution. And it really has been a mess because I almost equate it to people trying to get a vaccine when they're notified they're in an eligible category. It's like they're trying to get a brand new iPhone on Black Friday. I mean, it shouldn't be like this lottery game of calling up random sites to see if they have the vaccine. Most people would think we would have some sort of central line registration portal for people to get the vaccine. And that's been a point of frustration for myself and many of my colleagues and constituents. You referenced the situation with nursing homes and COVID patients being sent from hospitals to nursing homes and sometimes back to pass away in many instances in either or the nursing home or in a hospital.
Attorney General a couple of weeks ago, Letitia James, the state attorney general, issued a scathing report about this whole situation, which now has become known as the COVID nursing home scandal. Your reaction and thoughts about her report?
Well, I think her report validated a lot of the concerns that were raised by myself and many of my colleagues from both political parties. We started talking about this, really in April of last year. There was a lot of concerns that were raised from a controversial March 25th directive from the governor's Department of Health. And that was broken, I think, in the press by the New York Post. In April, I joined with then Assemblyman, now member of Congress, John Marino, in calling for legislative hearings. We were able to get some support from our colleagues, namely the chairman of the Health Committee, Dick Gottfried, to hold those hearings in August. At that point, the governor essentially rescinded the March 25th directive because he put a new executive order that superseded it. But that directive did a couple very important things. One, it prevented any nursing home from denying COVID positive patients, which essentially forced them to take them in. And the second thing that people don't talk about a lot is, which was unique compared to any other state, it also prohibited nursing homes from requiring a test before admission or readmission. So if they wanted to confirm that this person still had the virus or not, they were prohibited from requiring that test. We had those hearings in August. The governor's DOH put out a report in July defending their March 25th directive. A lot of us found it to be incomplete because it was missing very important pieces of information, specifically the number of nursing home resident deaths that occurred outside of the facility. So, if you're in a car accident and tragically die, but you die in a hospital, when we review these things, it was an automobile accident that killed you, not the hospital, right? So when you're reviewing our performance in nursing homes, and did this increase mortality? Did this increase the spread of infection? You need to have that complete picture. We were asking for that information for months and months and months. Stonewalled by the Department of Health and the governor's office, told they were fearful of double counting, wanted to make sure it was accurate, told me they needed to reconcile it. I wrote to the CDC, I wrote to President Trump, and eventually with Assemblyman Ron Kim, we wrote to President Biden. The very first day that he took office, we made sure we hit the send button, asking for his help to get this information out into the light. And as you said, John, the Attorney General's office, about a week or so later, unearthed that what we all feared, that the Department of Health was underreporting the full scale of nursing home resident fatalities in New York State. So that the picture that was being painted to us and provided to us in the summer and spring of last year, we knew it was bad, but it was actually much worse. And her report really really snowballed this issue. A couple of weeks later, the Empire Center, a nonprofit group, won a state Supreme Court case against the state of New York because the Department of Health violated FOIL. So the Empire Center was able to get the actual full number. And since then, they did their own analysis, which showed there was a statistically significant correlation between that March 25th directive and an increase in mortality. So when the Department of Health told us in July there was absolutely no correlation and that it did no harm, that is false. We know it made a bad situation likely much worse. And I would not credit all 15,000 lives lost to that one order. I don't think that would be fair, but certainly it made it worse. And it potentially could have correlates with over 1,000 lives that were lost.
Mm-hmm. Now, you refer to FOIL, the Freedom of Information Law, of course. What was the motivation? And this is something I have not understood for a year now. What was the motivation for the Cuomo administration to make this move, moving COVID-infected patients to a nursing home from a hospital, or maybe back from a nursing home to a hospital where they eventually pass away, knowing this would happen based on the governor's own statements?
You know what? The governor's office and Department of Health have given us a large kind of array of excuses here. So, and it's kind of changed it has changed in time, which is a bit alarming. But in the beginning, we were notified that the March 25th directive was about protecting COVID positive patients from being discriminated against. We wanted to make sure that they could be admitted and they wouldn't be discriminated. Then I think most people would think it was about freeing up hospital space, because we were thinking, oh, there's these very scary projection models about overwhelming the hospital system, which would be a very, very serious problem. And then we were told, well, the information that they were omitting, it was about, we wanted to make sure the information was accurate. That's what the health commissioner told us in August. They were fearful of double counting. And months later, they told us, well, we're still trying to reconcile the data. That's what it's really all about. We're trying to reconcile it. So, we knew, I believe they had the information the whole time. I mean, that's where I'm at this point, because the breaking news story about a week or so ago was there was a private partisan meeting the same day that the Department of Health was mandated by court order to release this information to the Empire Center. That same evening, there was a private meeting with the governor's secretary, Ms. Melissa DeRosa. She's essentially the governor's right-hand chief of staff, the health commissioner, and the Democrat chairs of health, aging, and oversight and investigations. And in that meeting, Melissa DeRosa actually admitted that the administration, quote, froze because they weren't sure how this information could be used against them by the Department of Justice and politically by members of the legislature. That is extremely alarming, because there was a DOJ inquiry by the federal government that was announced in August. It's unclear to what extent the Department of Health and the governor's office ever complied with their requests. But that actually has sounded off a lot of alarms from myself and colleagues about the potential criminality that may have occurred, that this could be the intention to obstruct justice of a potential DOJ investigation. And so it tells us that, was this really about the accuracy of the data, or was this about protecting the political image of the governor, who was getting lauded throughout the country? He received an Emmy for his press briefings. He sold a book. Or was this about public health? And it sounds like this was really more about politics than public health. And the really damning thing, John, is that we had different proposals in the legislature to do things like create step-down facilities for nursing home residents before they would go back to the nursing homes. We had federal support through the USNS Comfort, the Westchester County Center, the Javits Center, with these Army Corps of Engineers built field hospitals. And there was opportunities for us to maybe make modifications and changes. And we weren't given that information, in real time. And that prevents us from making changes as policymakers. So that is alarming. And that's kind of where we're at now. And that's why you're hearing people even talk about it's been reported the FBI is investigating, that the U.S. Attorney's Office out of Brooklyn is investigating. And we're getting to the point where a lot of my colleagues are even calling for impeachment. And you can say impeachment with a straight face.
Mm-hmm. Now, you referenced Assemblyman Ron Kim of Queens and the meeting with Melissa DeRosa. Ron Kim claims he received a threatening phone call, an intimidating phone call from Governor Cuomo the next day, ordering him basically to change his public stance on this whole issue. And Ron Kim's uncle, of course, passed away in a nursing home from COVID. Have you ever received a call like that from Governor Cuomo, especially at this time during this kind of a situation?
No, I can't say that I have had the misfortune of being on the receiving end of one of those calls, but just through speaking through with colleagues from across the state, it's not an uncommon thing. I think Mayor Bill de Blasio confirmed that, as have many others. Senator Jim Tedesco, when he was a minority leader of the Assembly, confirmed that from when he was, well, it's actually a different governor. That was with Elliot Spitzer. But, these stories are not uncommon in New York. And my colleagues from the Senate and the Assembly, Assemblymember New, I believe Senator Biaggi, a couple of years ago, they questioned the governor's campaign fundraising activities in Albany during the middle of the budget. And a response from the governor's spokesperson, not the governor directly, called them effing idiots publicly in a New York Times article. So this isn't uncommon, and I think it's people accept it, but I haven't personally been on the receiving end of any of that. So, and I'm, if it does happen, I think he knows that since I'm a Republican, he can just kind of dismiss some of my comments and alarms and try to say it's political, even though it's really not. because this is something that we're shoulder to shoulder with a lot of our Democratic colleagues on.
Final few minutes with Kevin Byrne, New York State Assemblyman, representing the 94th District in northern Westchester and in Putnam County. No more Dutchess yet. By the way, this could be redistricted again, as you mentioned at the beginning, where you get Dutchess back into your 94th District, right? This has moved around a lot over the last 30 years. Vinnie Leibel and Greg Ball and others have held your seat.
Correct. Yeah, correct. And there's a potential for changing the way we redraw the lines. There was an independent redistricting commission that was established several years ago through a constitutional amendment. There's a proposal that will be on the ballot this November. I'm going to be urging people to vote no on the referendum. People can make their own decision in the ballot box. But what it essentially does is repeals the provision that these lines need to be approved by a larger majority in the state houses. That would require participation from both conferences, Republican and Democrat. By reducing that threshold, they're basically allowing one party to confirm the district maps, which makes it much more of a partisan process. And it seems to me that we're already changing this quote unquote independent redistricting process before we have even tried it. And I think that is a big mistake. I would personally like to see it be more independent, and maps should be decided based on geography and population and not necessarily on political ideology.
Now, before we wrap up, April 1st is coming up soon, just over a month away. The state budget is due by then. In our final few minutes, give us your thoughts on where the budget process is right now. And if you had your way, what would you put in the state budget that might not be considered at the moment? But who knows what happens between now and April 1?
Well, yeah, we're right in the throes of the budget season. We actually have our final budget hearing coming up, I believe, on Thursday with the Health Committee. The state budget is about $190 billion as proposed by the governor. The largest portions are typically healthcare, education. Medicaid is certainly a big portion of it. So my position as ranking member of the Health Committee is an important one. I would say all these programs have importance, but there's opportunities for saving money. When people talk about trying to lower taxes, you have to find a way to save money. I would say that we spend a tremendous on subsidies and tax credits to the Hollywood film industry, which I don't think is appropriate. We also spend a considerable amount of money on pork, which is a way of picking winners and losers. The governor has spent millions of dollars over the years on marketing, things like Startup New York. So those are ways we can save money. I think there's an important need in infrastructure. We spend, and I think we need to do more on infrastructure spending for our local roads, bridges, and culverts. We also need to look at reinstituting programs that were eliminated last year, like the adult cystic fibrosis program. That was a program that actually helped adults with cystic fibrosis come off Medicaid and use private health plans. It helped supplement those private health plans and enabled them to go out in the working world. And when you think about the coronavirus and who is susceptible, you think about our most vulnerable, our elderly, our seniors, but also people with comorbidities. And I can think of a few other groups of people that are more susceptible to this respiratory virus than someone that suffers from cystic fibrosis. So I would very much like to see the state show in its priorities that we bring back the adult cystic fibrosis assistance program.
Nothing that looks like a Buffalo billion in this budget proposal, at least yet, right?
We're still going through it. I wouldn't be surprised if something else pops in. There's a big discussion about the governor's emergency powers and disaster powers. I think he's really abused it and has taken it on too far. One thing that makes New York unique is he extends his own disaster declarations without additional legislative approval. I'm not against the governor having some sort of emergency powers to be nimble in a state of emergency, but it is not designed to be for prolonged periods of time. And I think he's absolutely abused this. And there's concern by me and some others because his powers expire in April. There's something else that's due on April 1st, and it's called the budget. And the governor does have the tradition of forcing controversial policies in the budget. That discussion needs to be separate and independent from the budget. So if that does get forced in there somehow, you better believe that I will be on the floor hooting and hollering, standing on my desk, making tons of noise.
94th District Assemblyman Kevin Byrne, we thank you. Hope we get a chance to talk again before April 1st and get into the budget a bit more and see where it's at that time, too.
You're very welcome. Thank you for having me again, John.
Thank you. Great to talk to you. Kevin Byrne here represents Northern Westchester and Putnam County in the state legislature and the Assembly in the 94th District here on the Cup of Joe political show, Westchester Talk Radio, now the home also of Putnam and Dutchess and Rockland Talk Radio, too, along with Fairfield Talk Radio, and also the home of Orange County Talk Radio now, too. We are made possible by Entergy, the Indian Point Energy Center, produced by Sharc Creative, also made possible by Wartburg Healthcare and Rehabilitation in Mount Vernon, Park Sterling Realty in Bronxville, and Michael Labriola Landscape Design and Construction in Armonk. Catch all of our Sharc Creative network programming, Westchester, Rockland, Putnam, Dutchess, Orange, and Fairfield County Talk Radio programming on our YouTube channel, Sharc Creative YouTube.